Many males come to me with their semen analysis report. Many times it is normal, many times they are worried. Sometimes the counts are low, or sometimes the count are zero. Many times the sperms are less motile, or sometimes they have zero motility. Sometimes the volume is less. There are lots of questions in a semen analysis report. How to read or how to interpret a semen analysis report. We will discuss all these in today's topic. Namaskar, good morning. I am Dr. Rajat, and you have started watching our YouTube channel, The Fertility Gynecologist. So, as they say, how to discuss a semen analysis report. This is how a basic semen analysis report looks like. I'll put it in the video also. So first of all, whenever a semen analysis report, the most important point of the question is how to give the sample for a semen examination. This is one of the most important questions. Whenever I tell my patients to give a sample for the semen examination, there are three things which are important. A, there has to be a abstinence of minimum 3 days and maximum 5 days. Why minimum 3 days? Because if it is less than 3 days, then the counts would be relatively less, and if it is more than 5 days, then the motility would be relatively less. Abstinence means either there should be no intercourse or no ejaculation in form of masturbation in last 3 to 5 days. This is one important point. Where the sample should be collected, it is also very important. Ideally, the sample should be collected in the hospital or a clinic or a laboratory. But in our practice, what we have found is many males, they find it relatively embarrassing or slightly difficult to collect a semen sample in the hospital. So what we tell them that they should collect the sample in their homes, in their confines where they are relatively comfortable, and they should bring the sample to the hospital or a laboratory within half an hour. Now, while bringing the sample to hospital or laboratory, sometimes the sample is displaced or misplaced, or it sometimes spills over. That should be taken care of, and sample should be kept at near the body temperature. How the sample should be collected is also very important. Ideally, the male should first of all wash his penis with soap and water, dry it, and within masturbation the first drop is very important, because 90% of the semen sperms are in the first drop of the semen. So if the first drop is spilled over or it is not collected, then the number of counts of the sperms would be falsely low. After the first drop, whatever first few ml they come, they should be collected, and even after that first 2 to 3 months, there are first to 2 to 3 minutes there are testicular contractions, and which help in getting more of prostatic fluid. That whole should be collected. That is very important. Now, this was about how to collect a semen sample and how to give a semen sample. Now if you see the first point in any seminal fluid examination is where the sample is collected. That is very important, like I said. Second is duration of abstinence. Again, I have explained the importance of duration of abstinence. It should be minimum 3 days and maximum 5 days, some cases 7 days, but ideally we say 3 to 5 days. The third point which you will see in the report is spillage. I mentioned the spillage. Why spillage is important? Because sometimes the false attributes of a low count or a low motility may be due to the accidental spillage, which the doctor may not be knowing or the laboratory person may not be knowing. Only the person who is collecting the sample may be knowing. One point to be noted is that this jar is a sterile jar and it is a wide mouth bottle. It has to be taken on the open only at the time of collection, and that is very important. Now then comes the physical examination of the semen. In physical examination, the most important point is the volume of semen. An ideal volume should be about 2 to 4 ml. Ideally, it should not be less than 1 ml. Okay. Now, if it is 2 to 4 ml, then that is fine. But if it is less than 1 ml, what that would suggest to me that there is a possibility of a retrograde ejaculation. Retrograde ejaculation means that semen, instead of coming out from the urethra to the penile urethra through the penis, it is from the urethra, it is going back to the bladder. So this is called as retrograde ejaculation. There are tests and there are treatments available for that, but this gives me a rough idea that there might be a possibility of retrograde ejaculation if the male is saying that there has been a no spillage. Again, like I said in my previous videos, a single sample of a decreased volume may not give us any idea. If there are multiple repeated samples of decreased semen volume of 1, 1.2, 1.5 ml, then we might think of a retrograde ejaculation. Next comes the point of a viscosity, how thick the sample is. Again, the more viscous the sample is, there are more chances of infection in prostate, seminal vesicles, or some kind of infection. But in most of the cases, the sample is viscous. Many people come and tell me that my semen is very thin, possibly the sperms are low. Just by seeing the physical examination of a semen, you cannot make it out that whether the sperms are low or not, or sperm is thick or semen is thick or not. That has to be taken care of by a proper qualified laboratory person. Next comes the most important point, that is the liquefaction in the physical examination. Semen is a thick gel-like substance when it comes out of the penis, and the moment it is out, it liquefies after some times. Liquefaction is because of the enzymes in the semen, and this liquefaction is very very important. If this liquefaction time is more than 30 minutes, 40 minutes, then, or maybe 60 minutes, then the chances that there may be some kind of problem or difficulty in conceiving, that is very very important. This liquefaction is especially important to us in IUI and IVF kind of things, but even in normal cases it is difficult. Next comes the biochemical examination, whether the fructose is positive or not. You have to just look at fructose. In most of the cases it is positive, but if it is negative, that means the content of prostate and seminal vesicles are not there, and there might be some kind of blockage that we need this patient to be referred to a urologist. pH in most of the cases is 7.5. The normal pH of most of the body fluids is 7.2 to 7.5. So that is fine. pH is not an issue. Now comes the most important point, which most of you and most of the people want to know, the sperm counts. The normal sperm count should be anywhere more than 15 to 20 million per ml. Again, I am telling per ml is important. Suppose the counts are about 12 million per ml and there is a ejaculate of about 3 ml, so there would be about 36 million count. So the sperm count should be somewhere about 15 to 20 million per ml. I have told in my previous videos on other platforms also that previously 20, 25, 30 years back the counts were lots more. But due to the lifestyle, the diet, the stress, the environmental pollution, constant exposure to the xenoestrogens, the counts overall have come down. And nowadays 15-20 million is a good enough count. You don't need 80 million, 100 million, 200 million counts for a male to impregnate his wife. Okay, so this was total counts, and total counts per ejaculate is the number of counts per ml multiplied by the ml which is there. Then comes the motility. Again, there are different kinds of subheadings in that total motility: rapidly progressive, slow progressive, non-progressive, immotile. We are only concerned with the rapidly progressive and the non-motile person, because sperm, if it is motile, then and only it is capable of fertilizing a ovum naturally. Otherwise non-motile sperms cannot fertilize a ovum naturally. In IVF ICSI cycles it is a different thing, but even in those cases we have to be very sure that non-motile sperms can lead to further infertility if there is a male offspring later on. So motility has to be more than 40 to 50%. That is very very important. But then again, motility is a relatively recent finding. Depends upon abstinence, like I said in the beginning of my video. So, and also it can be increased, it can be decreased depending upon the health of the male, depending upon various factors. And there are various factors affecting the motility which we discussed before, we will also discuss later on. Next is the important point called as morphology. Morphology tells how the sperms look under the microscope, what the head piece looks like, what the main body looks like, what the tail piece look like, and whether it is normal or not. There is a WHO strict criteria which says that minimum the normal sperm morphology should be 4%, and if it is more than that, that is fine, but if it is less than that, then the chances of the conception may be slightly less. But that does not mean that 1%, 2% or 3% or even 0.5% sperms, if they are normal, then they cannot conceive. You see, we are talking about millions of sperms, crores of sperms are there. 1% of that crore would mean somewhere in about lakhs, 2 lakhs, 5 lakhs. So that doesn't mean that they cannot conceive. Only thing is, we have to work towards improving the morphology. There can be an abnormal head, there can be an abnormal tail. Next, in the microscopic examination comes the cellular elements. There can be pus cells, there can be red blood cells, there can be immature forms. Pus cells normally are about 0 to 2, but if they are more than say about 5, 10, 12, then we may think that there is some kind of infection in semen. It can be infection in prostate, it can be infection in seminal vesicles. We need to give a course of antibiotic, but 1 or 2 pus cells per high power field is okay. We do not need to do anything about that. Immature forms I am wanting to highlight. Immature forms is especially important in the cases of an azoospermia, where we need to focus whether that a person with azoospermia or a zero sperm count, will that person ever have his own sperms in his semen or not. If there are sperm cells which are of immature forms, that means some kind of spermatogenesis, some few percentage of these seminiferous tubules are still working and they are making some kind of sperms. Maybe they are not maturing. So that is a good sign for us, especially in a patient who is undergoing the treatment, the hormonal treatment, the medical treatment for an azoospermia. And last and the most important point, which is very, very important to us, is the functional analysis by a automated analyzer, that is total functional sperm count, TFSC. The total functional sperm count means out of all that say X million sperm count, out of that how many sperms are functional, because ultimately that functional sperm count would be one which will help impregnate a female, his partner, his wife. That would be important, and those functional sperm count ideally should be more than 13 million per ml. Now that is a quote unquote textbook definition of a normal total functional sperm count, but we have seen 4 million, 5 million, 6 million sperms per high power field of total functional sperm count is also good to help conceive the female. So this was about how to read a semen analysis report. I'll come to one point now. The people have doubts regarding various things, and most of the doubts are regarding sperm counts, motility, and the total functional sperm count. Let us come to it one by one. Suppose a patient has a semen, the male has a sperm count, total sperm count of about say 10 million per ml. And because on the right hand side of any report there are the normal average reports are given, the patient would come to me worried, sir, can I conceive? My sperm counts are less. What do I need to do? First of all, there is no need to worry. Just because one report is normal, you do not need to worry. And also, I don't think that you need to get the report done again and again. Many people come to me with every monthly report of their semen analysis. That also does not need to be done. I have told before also, I am telling now also, every male needs to take care of his diet, his lifestyle, stress management. In diet, we are taking 4 poisons: potato, sugar, maida, and gluten. These need to be avoided. We need to do at least 50 to 70 minutes of physical activity of day. That does not mean going to gym every day for 50 to 70 minutes. That does not mean going to swimming pool or this thing, but you need to be mobile. Yes, you need to do some kind of strengthening, some kind of weight bearing exercises, plus you need to inculcate a good amount of walking in your daily life. People don't walk for any casual things. They go for with by a two-wheeler or a four-wheeler. They tend to use lift more often even the stairs is available. So these are the lifestyle changes you need to make. Plus, there has to be some kind of any mental stress relaxation in form of deep breathing, yoga, early morning walking in the gardens. All those things have to be done. You have to eat plenty of fruits, plenty of antioxidant rich green leafy vegetables, tomatoes, carrots, beetroots, strawberries, kiwis, oranges, all papayas, pineapples, pomegranate. All these foods, they are superfoods as far as male infertility is concerned, and these things have to be eaten raw. The juice does not have to be need to be taken. And you have to look for, either if you have a thyroid problem or you have a diabetes problem. First things, most of the males who are obese, who have got a paunch in their belly, that means their estrogen level is high. If their estrogen level is high, the testosterone level would go down, and if there is a low testosterone to estrogen ratio, then the sperm count would automatically go down. So first things first, we need to make our abdominal girth or the waist size low. It should be, our target should be 32 to 34 inches, and that should be our persistent aim for all those people who have low counts or low motility. Now, God has given testes out of our body in a bag called a scrotum for a reason, because the body temperature average is about 37 degrees centigrade and outside temperature is relatively cooler than the body temperature. Sperms die in heat. So if they come with any contact which is heat, say hot water bath, saunas, or persistent use of laptops on our thighs, or the drivers who drive for a long time, there is a lot of heat generated, or the workers working in the welding industries, or those kind of things, they have got a zero or a less sperm count. So there should be lifestyle modification to avoid the persistent continuous exposure of heat to the scrotum. There should be no wearing of tight underwears, tight jeans. There should be loose hanging cloths should be worn. And also avoidance of smoking, avoidance of tobacco, avoidance of alcohol. All these kind of things, they make things easier. So this is the things which need to be done first before doing repeated sperm counts again and again. And over a period of time, with your consultation with a doctor, you can start some medicines like clomiphene, letrozole, or hormonal evaluation needs to be done in form of testosterone, estradiol, prolactin, thyroid, and diabetes. These are very, very important things. I have discussed azoospermia before. I'll again discuss azoospermia later in other videos, how to go about the azoospermia. But this was a basic brief about how to read a semen analysis report. Most important thing, do not get carried away or do not get upset by a single abnormal semen analysis report. A single normal semen analysis report is reassuring, but a single abnormal semen report does not mean that you might be having a problem. Only thing is, go to a doctor, correct your diet, lifestyle, stress, eat a good dose of natural antioxidants, take good multivitamin supplements, visit a doctor, trust your doctor, and believe me, things would be fine. We have started making these videos to educate our patients. It is a lot of hard work, lot of passion is involved. We request you to kindly like the video, share the video, and subscribe to our channel. Thank you. Bye-bye.